You may have noticed we're wearing red here. It's National Wear Red Day to raise awareness about heart disease.
And heart disease is the #1 killer of new moms. And pregnancy-related deaths in the U.S. are rising at an alarming rate. So that's an important part of this. This morning, Dr. Alexandra Kharazi from Grossmont Hospital and survivor Laura Vargas both joining us to discuss what we can all do to care for our hearts. Good morning, ladies.
Good morning.
Good morning. We want to start with you, Laura, because we want to talk about your condition and what happened after the birth of your son. If you could share that with us.
Yeah, absolutely. I was born with a rare form of heart disease, also known as cardiomyopathy, called left ventricular non-compaction. And in 2015, I did get pregnant with my son. And about 3 months after I had my son postpartum, I did go into congestive heart failure.
Wow. Oh, my goodness. So obviously you're here with us today, thank goodness, and here to share the story. Tell us how you got through that and what the message is that you want to share this morning.
Yeah, absolutely. I think the #1 thing that I tell everyone is me getting through that required a lot of mental strength. I think it's really important for women to be aware of their bodies and the signs. There's certain contributors that will make it higher risk for you to, come across heart disease or encounter heart disease yourself, which are some of the things like your race, age, obesity, and hypertension, which is also high blood pressure.
Incredible strength you've shown there, Laura. Dr. Kharazi, we want to talk with you about Laura's story, and it's just an example of why it's so important for women to take care of their health, right, and take care of their hearts.
Absolutely. Sharp Healthcare is actually a sponsor of the Go Red Women movement for the American Heart Association. It just focuses on inspiring and educating women about their heart health. And women, as Laura mentioned, do go through different stages in their lives, such as pregnancy and menopause, that increases their risk for cardiovascular disease. And they also experience different symptoms than men may experience. So it's important to know the critical numbers. I think blood pressure, cholesterol, blood sugar, body mass index, those are all things that can play into risk factors that can be modified. Just general tips for maintaining heart health is getting exercise, eating healthy, as well as keeping track of those risk factors that can be modified.
And Doctor, just looking at the Go Red for Women's website, it's a great resource. Right at the top, it says the simple fact that you're a woman puts you at higher risk of cardiovascular disease. Why is that the case? This is not a man-only kind of issue, right?
Right, absolutely. So women are actually, like I mentioned, different stages in their lives expose them to different risk factors. For example, during pregnancy, women experience gestational hypertension, gestational diabetes, preeclampsia, and these are all things that can increase disease, cardiovascular disease risk later in life.
All the things you just listed, I went through with the birth of our child. Right. So, obviously it does make things a little more elevated, a little more nerve-wracking when you're simply by being a woman.
It's worth noting in this segment, while we've been talking with you ladies here, 2 women have died from heart disease every 80 seconds. So, Laura, last word with you here before we wrap things up here. What's the message you want people to hear here today?
Yeah, I want women to take power of their heart health. And if people want to learn more about the Go Red for Women movement, especially here in San Diego, they can actually visit the website at www.sdgored.heart.org.
All right. Thank you both so much for being on. And your family is adorable, Laura. It's so cute to see your
Thank
photos
you so much.
with your little boy. So congratulations.
Glad you're all healthy.
Yeah.
Thanks for coming on.